हेलो, माय नेम इज़ सुधीर परमार। 2 साल पहले से हमें प्रोस्टेट का प्रॉब्लम है। हल्की फुल्की परेशानियां होती थी। कुछ जब मेडिकल रिपोर्ट्स ठीक नहीं आ रहे थे, लखनऊ में थे हम उस समय, वहाँ से कंसल्ट करके हमने अपना एमआरआई करवाया। तो एमआरआई में कैंसरस रिपोर्ट आई प्रोस्टेट की। सो आई कंसल्टेड अदर डॉक्टर्स, I got a PET scan done. I consulted telephonically doctors outside Lucknow also, or amongst the doctors I consulted was Dr. Aditya.
He was advised surgery in Lucknow. Some doctors even advised him hormone therapy and radiotherapy. And it was then that he contacted us seeking an opinion about further course of action. We had an extensive discussion about his disease status and the different treatment options that were available to him. Both surgery and hormone and radiotherapy were the options available to him.
लगभग हमने माइंड में कर लिया था कब कि I will other things being okay go in for surgery. So from the surgery perspective I consulted 3 doctors. Then finally जब decide हो ही गया तो हमें सबसे ज़्यादा confidence डॉक्टर आदित्य और उनकी टीम पे आई।
He then came to Delhi. We evaluated him once again, physically examined him, and had an extensive discussion once again. And then we finally planned that he should have a robotic surgery. The surgery that we planned for him was a robotic radical prostatectomy and bilateral lymph node dissection. We got all the clearances done before the surgery, the pre-anesthesia and the cardiology evaluation, and he was admitted one night prior to the surgery. The surgery was uneventful, there was hardly any blood loss, and because there were no major cuts in the body, his recovery was very fast and smooth. He was up and about the same day, he was started on oral diet the same evening, and in 2 days' time, he was good to go home.
It was a very successful surgery. Anesthesia से निकल के जो हम सबसे बड़ा डर रहता है कि कितने पेन में रहेंगे हम, लेकिन पेन was managed.
He came back to us after 7 days for his catheter removal. We removed his catheter. He was doing well after the catheter removal, and the final pathology report revealed that all the cancer cells had been removed from the body because all the margins were free. There were no cancer cells remaining in the body. There were 9 lymph nodes on the right side, 12 on the left side, all were free of cancer. So he's now cancer free, and all that he needs to do is a regular PSA blood test, which is 3 monthly in the first year, 6 monthly in the second year, and then onwards an annual blood test.
And all I can say is that they have done their best, and I'm leaving here a fully satisfied patient with the hospital, with Dr. Aditya and his team, with the staff. It's been a very, very positive experience.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.